I'm doing well. I'm symptom free so far, so that makes me feel good.
That beats Idris Ilba, who is now latest celebrity to have tested positive for COVID ID.
Mm.
So supposed to be the new James Bond, I guess, but which I was looking forward to. But in fact, now what is it? The other I was very tempted to go for breaking news with this. I guess the ninth Fast and the Furious movie had to be delayed a year because of the COVID. I'm just saying, oh, wipe that slur off your face. Okay, yeah, I know. Okay, I'm probably gonna get somebody's gonna
I'm
get hell
so
on
sad.
me for that one. Yeah,
I'm
I wish.
sorry.
You have to have.
I'm still bitter about the last movie. It was just the worst thing.
I know,
And I
and
really
that
liked that
ending.
series. I really liked it, but I don't know what happened, if it was directing, if it was cinematography. I didn't realize we were going to be talking about Fast and the Furious, but I'm opinionated about it, and I really don't like that one because it made me really mad. It was almost as bad as a couple other of that series. Nah.
Well, yeah, no, yeah, I noticed you've got an opinion. So, yeah, well, I
Oh
wish
no.
that that was, yeah, I wish that that was what we could, say was the biggest breaking news for today. In fact, we did last night. We did the hangout, which thank you all for participating in that. We're going to do that again either Saturday or Sunday. We're going to have a hangout. People can come tell us their stories of what they've been going through, what they've been seeing. I think the most interesting one that we had was the trucker who came on last night and told us about the weight restrictions being lifted, so that and safe health and safety guidelines being pulled as well, so that they could operate really. Looks like without sleep or much of any health or safety concern in trying to get as much
It's really bad.
products or as many products, yeah, as many products as they can to the grocery stores as rapidly as possible. So that was an interesting story, and we hope that you guys will join us for another one of these coming up sometime this weekend. But in the meantime, we did do breaking news earlier today. I said we wouldn't unless there was something special, but the U.S. has announced its first curfews. A number of cities. I think I had mistakenly just the way I'd worded it, given uh, three states that have issued curfews. The governors of the tri-state area, New York, Connecticut, and New Jersey, have acted in unison with a number of policies. But I think there was an error as to the curfews. I think it's only New Jersey that has issued the curfew. New Jersey is under curfew as of about an hour ago, and they're going to be continuing that at least through March and revisiting that in 2 weeks. A number of cities have also enacted curfews. The city of Monroe, Union County, and also Palm Beach are all now under curfew. San Francisco has asked that everyone stay indoors and that they hold on one second here. I've got five computer screens, and I'm basically learning that even that isn't quite enough to shelter in place, is what they are asking. France has now banned all family and social gatherings and closed its borders, and it will be on lockdown as of tomorrow noon. Canada is now denying
Oh wow.
entry. At first, Canada was making exceptions for the U.S., but now I believe they are denying entry to anyone who isn't a citizen or permanent resident. So the U.S. border with Canada is now going to be closed. An Ohio judge has denied the governor's request to move the state's primary election. So Ohio will be having their primary elections, and my guess is that's going to be it. Yes, that's yeah. I think that's a
Oh,
bad
that's a
idea.
really good point. Oh my
Yeah,
gosh.
that's yep. That I
I did
well,
not
and
think
I can
about that.
understand the governor has, and a couple other states have moved it, but in Ohio it's been denied. The Washington primary was today. Biden beat Sanders in the Washington primary today. Normally that would have been breaking news, but that was last week. What were you thinking?
It's not really
um,
breaking news anymore. It's just the train wreck that is time right now. Fuck. All right.
Yeah,
Anyway,
there. By the way, there is a presidential election going on, but I haven't seen
I
much
know,
about
right?
that.
Everybody totally
Uh,
forgot about it. Like I did too. Oh
yep.
man.
So, Saturday Night Live has halted production. So there's going to be no
What?
new episodes for a little while, and so that's basically all that's happened since, essentially, since our last broadcast about 4 or 5 hours ago. I will go over for people who didn't see roughly what we covered in that, because there was a lot covering that one. That was from the 20. This is why it's 24 hours. Yeah, yeah. This is why basically we're now going every day. Um, we had set the bar with the everyone thought it was World War III too. There were a lot of people taking World War III seriously when Iran launched missiles into the Iraqi Green Zone, and we were covering it. We're like, look, it's not World War III. Everyone should relax. And this is, we've talked about people having to relax some on this, and most people are actually completely safe. Everybody has a shelter in place for those who aren't safe, but it's the people who are being asked to shelter in place, the vast majority of them are actually perfectly safe, even if they were out in public. The problem is the people who
Yeah.
aren't, and I think the last figures from the CDC was 3 million Americans. Worst case scenario, if we weren't taking these procedures, we would be looking at the loss of 3 million Americans in about a month's time. So that's why we're doing this. That's a pretty significant loss. So for people, again, who are saying this is overreaction, it is overreaction to the proportion of how much damage it's going to do to most individuals, but to the immunocompromised, the elderly, no. So, all right.
Yeah, I
So to
think
go over what we,
that's the
yes,
biggest
please.
like advice that people have been giving on things like um the last week tonight, John Oliver and the Colbert Show that have been giving some really good advice from actual health officials on this thing, which is more than we can say for our actual presidential administration. But what
Oh, Jesus.
we can say is that there is a difference between caution and panic. There is a difference between, um, you know, overreacting and buying up all the stuff, all the supplies, especially masks. There's been a warning that if you aren't currently sick or at a particular risk, you shouldn't be buying up masks or gloves and things like that, because even if we individually were to catch that, it wouldn't be as severe. And what we need to do is be prioritizing those supplies for the people who need it most and who are at most risk for being harmed the most by this virus. Um, and so also, not going to your health provider, particularly if you are a young and healthy person, because we want to, again, leave those resources and the time that the doctors have to spend with people who are at particular risk if they do contract that virus. So there is a lot to be said for, staying away from public areas as much as you can, even if you're not going to be negatively affected, because it is, um, the less people that it spreads to, the less likely it is that more people will die from it. Um, but that was a big concern of, like, buying up all of the supplies, buying up all the hand sanitizer, the masks, the gloves, the water, the toilet paper. I'm sure we could talk for a little while about the toilet paper epidemic. But it is important to know the difference between what you need and what is just making you feel safer, but not actually making you any safer.
I think that's an excellent point. Most people aren't aware of what those masks are actually for. Those masks do not offer you basically any protection whatsoever. The only reason they offer you a touch of extra protection isn't because they're or keep filtering in any way. The only little protection they offer is you're less likely to touch your mouth because you got a mask over it. You can still touch your eyes and get infected that way, but they're not to protect you. The masks are to protect other people. If you cough, you're coughing into the mask and not out into the open. Those masks are for people who are sick and for healthcare providers, because if they have anything that's wrong with them, even if they're not showing symptoms, and they cough on a patient, that they are dealing with people who are already in trouble. They could kill them. So that's why they wear them. They're not wearing them for their own safety. They're wearing them for your safety. So there are people who sit there and say, I don't want to get sick. I better wear a mask. The mask is doing nothing for you, and it's taking away precious resources for other people. So that's an excellent thing on the masks. And the French medical authority has said, and we'll reiterate this, we covered this last time, we got a little pushback on this, but I do think it's worth mentioning. And this seems to be, this is just what they've observed. This isn't a study that's been done yet. This hasn't been confirmed yet, but they appear to be suggesting that ibuprofen is actually reducing people's resistance to this, and it is making things worse. And my understanding is that it's because ibuprofen and corticosteroids, any kind of what is it? Anything that reduces swelling
Anti-inflammatory?
is thank you. That was the word I was looking for. Yes, and anti-inflammatories seem to have some negative impact on the immune system, and in this particular case, it's a problem. So they are recommending, as of this moment, that you acetaminophen, Tylenol, anything like that, to try to stay away from. If you think you're sick, stay away from ibuprofen until that can be either confirmed or denied. It's not yet confirmed. This is just a pattern they've noticed, and there is some reason to suspect that that may be the case. So, but they don't understand the mechanism. There hasn't been a study done. This is there in the field, like, hey, we figured something out. Yes.
It's also important to know, again, that if you are a reasonably healthy person, there isn't exactly a treatment for this. And so even if you do make it to the doctor, they're more likely to just tell you, you basically have flu symptoms and you have to treat it the same way. And so you need to isolate, you need to stay home and rest and wait till it passes, because it probably won't have a huge effect on you if you're a relatively young and healthy person. But again, going to the doctor and even getting the test done isn't quite necessary, whether it's the flu or the coronavirus. If you're young and healthy, staying home, staying away from the doctor is what people have been suggesting. That facility and those resources of even testing and treatment and doctors are there to help patients and that are older and at risk, because the older people are getting treatments not related to the virus itself, but related to their getting help breathing. And so those aren't resources that you'll need if you're a younger and healthy person. You won't get to that stage of the development of the virus. So there literally isn't anything they can do. And again, it won't really matter if you have that or not. It will just make you that much more in need of staying home, staying away from the rural population.
Well, let's clarify that just a little bit. That's if you're in the U.S. That's, I think, the best advice in the U.S. If you're not in the U.S., you should get tested if you have any reason to suspect, and maybe in some cases if you don't. Most other countries are successful and have enough testing kits to test everybody, and they do want to know even before people show symptoms, because they're trying to reduce the rate of infections. The U.S. does not have even remotely enough testing kits. So at present, until we boost our testing ability, that's absolute yes. Don't really, if you think you've got it, isolate, stay away from everybody. Testing in the U.S. is right now, it looks like 3 to 4 weeks behind where it should be. In other countries, they're testing everybody for the most part, any possibility, because that way, if they know you've got it, they can isolate you. But this is the U.S.
And that is also,
we have spectacular healthcare.
And that's also why it's important to isolate as much as possible in general, even if you don't have any symptoms, because it does take a while for those symptoms to come up. So again, if you're outside of your home and spend time around other people more than you need to, then you're that much more putting those people at risk of you catching it and passing it on, or you having it and passing it on without knowing that you do. So that's not good.
Yep. So let's go over sort of what's been going on. We covered this actually. Some of it's going to be from earlier today, and a little bit of it's going to be from yesterday. The CDC has recommended that all schools in the country close for a minimum of 8 weeks. At least half the states in the union have closed their schools. Yeah, the president has come out today, or actually I should say the White House, I think the president echoed it, but the White House at a minimum has come out today and said that they are recommending that people do not meet in groups larger than 10. A number of states have bans of 25 or 50, but the White House is making a national recommendation of no gatherings, groups larger than 10. This includes weddings, religious services, so on and so forth. They are considering a national curfew. They're considering right now, yeah. Oh, we're just getting started. This is going to be a long list. They are considering a national curfew right now. It looks like at a minimum, at some point in the next 3 or 4 days, we will be looking at a recommendation from the White House as to a national curfew. It looks like it will be voluntary and not mandatory to start. Mike Pence's office has come out and said that is completely off the table. There are at least 3 sources that have leaked and said, nope, it is very much on the table, and almost certain that there will be unofficial, or there will be official recommendations. They won't be binding, but they will be suggested to they will be recommended to every state. COESA for 5,000 won. The AFP reported the U.S. is moving with the first human trials of COVID-19 vaccines. That is, in fact, correct. No, that is not a spoiler. They were slated to start that today. I haven't checked to see if they started it, but I assume they did. They are testing a COVID-19 vaccine. The Guardian is reporting that there was a German report that actually a German pharmaceutical company may be close to a vaccine themselves, and the Trump administration apparently tried to purchase it. According to the company, this wasn't an attempt to get the vaccine for, yeah, we did cover this earlier, so I'll move off from that. But there's at least several vaccines that they're working on. The problem is it takes a while to really know if these things are working, and it takes at least as long to figure out if there are any side effects. The vaccine may work, but may end up giving you something else 3 weeks on down the line. San Francisco is being asked to shelter in place. The New York Stock Exchange, once again, for the second time in a week's time, tripped the breaker when the Dow lost over 8% and trading stopped. This despite the unprecedented move of the Federal Reserve cutting the interest rate to roughly 0% for the first time in the history of the Federal Reserve. The EU is proposing a ban on the EU is doing a ban on non-essential international travel and is proposing a lockdown of the entire European Union. Boris Johnson has apparently reversed his position that we reported on just yesterday, and is now saying that people should avoid all non-essential contact and travel. And it appears that that England is on the verge of a lockdown, and will probably be on a lockdown in the next 24 to 48 hours. MGM Grand has closed all of its Las Vegas casinos, including the Bellagio, the MGM Grand, the Mirage, the Excalibur, the Luxor, the Park MGM, and the Aria. That is the biggest casinos in Vegas. All the others will probably follow suit, meaning Las Vegas is shut down.
Wow.
Maryland, Indiana,
we were just there, by
Kentucky.
The way.
Oh yeah,
that's crazy. Yeah,
you made it just in time.
We walked through the Bellagio and everything, so they're all closed. That makes sense that it would be closed because there's people just crawling all over the strip all the time. So that makes sense.
Yep. Well, Connecticut has casinos. I assume they're closed. The casinos in New Jersey closed today. Maryland, Indiana, Kentucky, and Michigan join Ohio and Illinois in ordering all bars and restaurants to close to anything but drive-through and pickup services. That's all bars and restaurants everywhere in all of those states. Maryland is prohibiting all gatherings, including religious services of people in excess of 50. Rhode Island, in excess of 25 people are now banned. 3 regional governors, New York, Connecticut, New Jersey. Yeah, I've got to. There's a lot to do,
I got it.
Yeah. Then we could cover it. I mean, nobody's going to remember, and hopefully,
good.
if you hear your state called, you're going to know. All right. New York, Connecticut, and New Jersey have closed all restaurants and entertainment venues. This includes gyms, movie theaters, and casinos. New Jersey has implemented an 8 p.m. curfew, which went into effect 90 minutes ago, and is the first state that I'm aware of to issue a curfew. I apologize. I'd wanted to know by this point, before we went live, if there's any precedent for curfews at a statewide level in the U.S. It has happened in other European countries, but the U.S., we tend to be very averse to that kind of thing. And it is now New Jersey at a minimum, and like I said, several other towns, which I covered earlier. The U.S. Supreme Court has postponed all arguments through March. And the death toll is now, let's see, it's over 2,000 in Italy and over 6,500 worldwide, and it is expected to continue to rise exponentially, although there are some signs in Italy it may be tapering off and that the lockdown is starting to take effect. And during all of this, the Health and Human Services Department was under a cyber attack for a period of today, which is just great. So a friend of mine suggested it's not the virus that's going to get us, it's what we do to each other when we get us. That's going to get us. And then the other interesting thing, Mitt Romney has proposed $1,000 to each and every American to help with the short-term consequences from this. And the former economic advisor to President George W. Bush, Greg Mankiw, I think I got that wrong twice in a row now, and Obama's former, I don't even know, oh God, and former Obama advisor Jason Furman have also agreed that a chunk of the 40 billion freed up by the national state of emergency, should be used direct cash injections to help Americans who are going to go under, especially in the service industry. Waitresses, busboys, people who rely on a restaurant that now cannot serve food legally and cannot admit anyone into the establishment. All of these people are now home. Many of them, especially, it turns out, only small businesses, as of the last decision by the U.S. government, small businesses are required to continue issuing paychecks throughout this. I think there's some exceptions, but I think in general that's what is being did. Large corporations are being in that requirement, and McDonald's can close, doesn't have to pay the workers while they are out. Mortgages are going to become an issue. There's going to be a whole bunch of problems. Also, New York, New York City Mayor Bill de Blasio is saying that a curfew is at a minimum one of the possibilities they are considering for the entire city of New York, and he's saying stay home as much as you can. The guidance might get a lot sharper at any point. This will get a lot worse before it gets any better. And that is what's happened in the last 24 hours. Yeah, that's just 24 hours.
Yeah. My sister works in a restaurant. My sister works in a restaurant in New York, and she told me that she was going to work this morning, and then she just came right back because they were like, nope, we're not opening today. And yeah, so that was kind of sad.
Yeah, so I think first of all, I thank you very much for the super chat. We appreciate it, and this is this is what we signed up for. This is why we get wife/boyfriend aggro. But hopefully we're of service. And so we do. Oh no! I was saying the reason we get the aggro, for spending a disordinate amount of time relaying all of this information to our audience. I believe it's helpful. I believe it's useful. But we appreciate the super chats. We appreciate that, and that's a great way to say that you support us. There was Kawesa who was reporting that they are in fact working on a vaccine. That's what we have heard as well. Yesterday we reported that they would be testing it today. I don't know what the status of that is. It's been crazy. We did the breaking news earlier today, and then we moved forward with trying to catch up. It's catch up because we have to verify all the sources. In fact, there was a claim you had heard, which I'm very suspicious of, but we're trying to verify all this stuff before we go out with it. But the only other one was Kevin Nunes, a Republican senator, has come out and said that people should take this opportunity to go out with their families, go out to restaurants, and enjoy the cheap prices and all this. The restaurants are
What?
closed. Yeah, the president was asked about Kevin Nunes saying that. He was asked about that during his last press conference. I don't know what his reply was, but somebody is very, very detached from reality. First of all, it's absolutely terrible advice and flies in the face of everything that, for the most part, every single disease or disease control organization on the planet right now is advising. Yeah, and then I don't know where he's going to find a restaurant. California hasn't closed them all yet, but I think they're. Well, I think California. I don't even know where California is on that. There are so many numbers gone over. And Coessa has done another super chat. Appreciation of the super chats can be expressed by visual pleasure. Now I demand it topless. Look, I did it once, and people just don't ever let you forget. Jesus. Okay. You don't want to know. That was I was experimenting. Nope. I was experimenting. Nope. And don't look for the footage. We took it down. I think Ansgar still has some. Yeah. yeah. I think that's probably a safe bet. Thank you, Coessa. Your support is, as always, very much appreciated.
You can.
Yes.
However, you can find my footage from Atheist Edge on the Atheist Marshmallow Challenge, which is probably some of the most embarrassing things I've ever done in my life, but it's fun.
I had said, I want to say, okay, did I? No, I think I just did this one. I did this one on, I was just on Caffeine Corner, actually, and I told them this one, but I have to now. You left me with no choice. It was the report that canines are immune. The World Health Organization has announced that canines are immune to the COVID-19 virus and has released 1.4 million dogs that were in quarantine. And so we now know the answer. Who let the dogs out? It took a second, but we got the lag. I'll chalk it up to lag. All right. So I think
also real quick.
Yes.
Does that mean that Sirius Black is immune? I don't know.
That Sirius Black is no. I know who Sirius Black is, but I don't think I got the reference.
He's only part dog, so maybe not.
Oh, that's right. Well, no. Was he part dog or is it Lupin?
No, Lupin was werewolf.
Oh, he's the werewolf.
Sirius Black turns into a dog, a black dog.
That's right. He does. That's right. I'm my knowledge in these. What can I say? I can't. I don't have the cred. I don't have the cred. Yeah, Canada shutting down its border is a big one. So they're all big ones. Goldman Sachs.
Real quick though, too.
Yes, please.
Oh, go ahead. Well, I mean, Trump in his speech, he implied, or he did actually explicitly say that that the U.S. would be shutting down the border between them and Europe, I guess, or not the border between Europe, but they would be shutting down travel from here to Europe, and that like made worries about trade go up, which meant the stock market like plummeted right after that speech. And then he had to like go on Twitter and sort of like backtrack a bit and say like, oh well, trade won't be affected, and basically like you shouldn't listen to the goddamn word that I say. So fun time.
He actually said trade too. He said trade would stop, and that was a miss. So he got that wrong. He said that we are testing thousands of people a day. We tested 12 the first time. He said that not 12,000, 12 people. We don't have enough testing kits. We don't. He also said that it would be paid for. Right now, it is not paid for. There have been the declaration of emergency has allowed for some payments of this, but the U.S. has thus far declined Medicare and Medicaid's. Actually, I think it's specifically Medicaid's request to follow emergency procedures, and which they did for Katrina and they did for 9/11, and no longer verify income for people who are requesting the aid in helping either with symptoms or treatment or testing. So right now, you still have to pay. They wanted to remove the verification, because here's the problem, which is if you're poor, you have to prove you're poor to get Medicaid, and that can take a while. If you now need Medicaid and you've never tried to get it, Medicaid wants to just say, listen, you tell us you're poor, we believe it, you're on Medicaid. That's what they've been requesting. Right. The Trump administration has denied that. We did have a question in the live chat. What about kitties? Okay, look, I did make the joke about the dogs and about the WHO, and okay, fine. The kitties was another thing. The kitties, unfortunately, are not immune to the COVID virus, and the World Health Organization called it a catastrophe.
Poor kitties.
I'm sorry, I had to. Okay.
Poor kitties.
I'm going to get roasted alive for that one. That one was bad. Yeah, I don't think you heard that one, and I think that's best left unsaid. So it does look like Boris Johnson is starting to take this seriously, which is a shock to everybody, and it looks like Trump maybe is starting to take this seriously too. He is currently suggesting buying back, or not buying back, buying a tremendous amount of oil into the oil reserves. We have plenty in our reserves. He's going to expand the reserves. Yeah, don't repeat it. Don't repeat it. I see what's in the live chat. It was a bad joke. It was like an uncle joke. It was a really bad uncle joke. You don't need to. I said that the World Health Organization said that the cats could still catch it, and that they were calling it a catastrophe. But at any rate, yeah, you see, they made me say, because they're repeating it in the live chat. So
YouTube doesn't let you make any mistakes.
No, they don't. They don't. One bad joke, one shirtless broadcast, and I'm just, and, it's like, well, and then because this goes live across I'm like banned in like 3 nations. I can't go to Italy because apparently broadcast is they're very Christian over there, and like, you broadcast without your shirt, and it was like you're a heathen and you can't come to it. Was, I didn't know until I was at the border, and it was I got turned back. I was okay. Anyways,
I am proud of the gender equality in that, though. That, like,
I know, right?
If I did the same thing, I think that might have had the same response, which is encouraging.
Well, they might have let you in if you promised to do it again. Would be my. I mean, it's the Catholic Church. Hypocrisy's never been a problem on their end, but.
Oh no.
During the 2008 crisis, U.S. stocks plunged by 57%. That's how much we lost during the 2008 crisis. Now we have, of course, recovered that and have well exceeded it. Right now, Goldman Sachs, not necessarily the best people to ask for what you think is going to happen, but they do make their money trying to predict these things. Have said that they believe that there's going to be as much as a 41% plunge in the S&P 500 by June, which would be 40% down from where it was at its higher this year. So, the economy is going to be the biggie. The economy for the working class in particular is going to be a biggie. People are going to want to go out and try to find ways to find work, and that's, of course, what really they shouldn't be doing. And I think you had said this earlier, and I think would like to reiterate, the problem isn't as much that you're going to go out, you're going to get sick, you're going to die, and that's kind of what it looks like. I went to the grocery store earlier today. Shelves are empty. It kind of does look like an apocalypse zombie movie. They're getting restocked. Everyone's working there, and everyone's optimistic, and I think things are better than they sound or look. But the concern isn't you're going to get sick and you're going to die. The concern is you're going to get sick, you're going to come home, you're going to give it to your kids, your family. They're going to go out and give it to other people, and this is why it goes up exponentially. This is not a linear. We had on Dr. Sygard, he discussed this. This is not a linear progression. The problem is one person can infect 20 people, each of them infect 20 people, and so on and so forth. That's what makes this. That's why both Italy and China now appear to have their numbers going down for the first time since this started. and it's because they went into lockdown. So the goal is, and here's the other thing, which is right now, I don't have the numbers on how many reported cases we have in the U.S. I want to say it's about 2,000, but estimates are it could be easily 10 times that amount, because the problem is people only report by the time they're really feeling sick, by the time they're really showing symptoms, and by the time they know it's something more the common cold. How many people are getting lower symptoms, are contagious, they think it's a cold and they're okay with it, but they're still transmitting it to other people. So this is why this kind of thing is important. And again, to the best of my knowledge, the United States has never issued a national curfew, and it appears there may have been during the Civil War, I guess, but in fact, I think there was during the Civil War. That would probably be, so the Civil War would probably be the last time there was a curfew of any kind. And I think at least a suggested one is going to be coming up in the next few days, and a mandatory one maybe even within a week. I think that's what we're looking at.
Mm.
And I hate to tell you this, but so far we've been pretty good at predicting these things on in time. We hit the ball out of the park on the Iran stuff. So that's where we are, folks. You picked a great time to start working here. Yeah, I was telling Courtney, I was just like, for our regular viewers, this isn't our regular broadcast schedule. This is like our second week. We're like, okay, we're gonna be on every day. We're gonna do another hangout thing. We may do a couple breaking news segments. She's like, what? You told me this was an easy gig.
Yeah.
So twice a week
we're
tops.
gonna have maybe like 4 to 6 shows a month, and you're gonna be fine. And it's just like every day.
Yep.
But luckily, I am working from home right now, as is my boyfriend. So I can, fit you in, at least for right now. So it's fine.
Yep. All right. So I think we're gonna get there's Jesus, and they did discuss toilet paper on the hangout too, and it's a psychological thing. You and I discussed that. We'll cover that some other point. I think 2 shows for one day. That's what it takes to get everyone up to date. Unfortunately, right now, and my hope is I don't think they're going to slow down this week. I think they're going to start to slow down next week if we start to. I mean, if the state goes on, if the country goes on some kind of either, what is it? Like a God, I've forgotten the terminology. Let's see, shelter in place
Lockdown?
or curfew or lockdown. Well, there's different degrees. Shelter in place isn't a curfew. It's not mandatory. They're just saying stay where you are. A curfew is mandatory, but it still isn't a lockdown. You can still go out, and then a lockdown is when it gets serious. So right now it looks like they're considering if we do either a shelter in place or a curfew of any kind, past that, the news is actually going to start rolling in a lot slower, and it's going to be stuff that any cursory glance at your newspaper will tell you. The problem is, like the amount of news that we have in between when papers are going out there. Yes, I know you're on the young side. A newspaper are these things that you could go and you could buy, and now you had to like use your hands to like open them and go through with them. But there was a couple benefits. You couldn't accidentally pull the cord on the paper and then just like all of a sudden your whole paper like just went blank. I mean, the ink would stay on the paper. That look just made the whole gig worth it. Yeah, but
Oh no.
the other downside to papers is it takes a long time to print them. Things change in between when they print the things and they actually hit the pavement, which is what's happening right now. The internet's going to be your only source of news, and there is a lot of also fake news out there. There's a lot of conflicting reports, and so we're spending most of the time, and there's a number of people in our live chat, by the way, who've been sending updates when they get something. We get international news oftentimes before the U.S. gets a hold of it. So, and then we just filter it. We try to figure out what's real and what's not, and then we bring it out here. So that's gonna. I think that's gonna start to come down as we get into it's just numbers of. But right now, each state is handling this differently. There's no national plan. there's going to be soon. Even and Trump saying this 10. I'm not sure if this is serious or not. Trump makes stuff up, and he doesn't know what he's talking about. And he has said that they're recommending gatherings of no more than 10. The most conservative state I have heard is 25. So that's a staggering number. I don't know whether he's actually really taking this seriously or it's just another unhinged, off-the-cuff comment. I got no idea. That's what he said. So we'll keep everybody informed. If you want to be notified, make sure you hit like, hit the bell, get the subscribe, and you'll be notified when we have breaking news. We actually do 2 regular shows. We've got on Cyrus the Skeptic to discuss his deconversion. He's coming on tomorrow, and then we've got Mikey to do a Stitch in Time. I have made it my business to make sure that he's got absolutely nothing funny to talk about for this week. He's going to have a hard time doing a comedy show. Given this, but he handled yesterday all right. But he's a talented guy, and we're entirely supported by our patrons and by the support of our viewers. So, if you like our content, if you want to get to meet us at our Patreon hangouts and all sorts of cool back end stuff, please consider becoming a patron. The information should be in the description. And otherwise, barring any, and every time I say this, we regret it. Boy, we really regret it. I shouldn't say it, but I'm going to say it anyway. Barring any sudden breaking news that's really extraordinary for these sets of circumstances, we're going to do another wrap up tomorrow and let everyone know what they've missed, both locally in the states and internationally, and see sort of what's going on and try to handle the bigger picture of all of this. So, is there anything else? Anything else you want to say while you're sheltering in place yourself?
Stay safe.
Yeah, that's yeah. Follow the advice.
Stay safe from the virus and from the panic is probably what I would say, and bad information. Yeah.
I was getting nervous. I right before show's closing out, and all of a sudden I get a one of the really significant alerts. I get the alerts on my alerts on my phone, alerts on my computer. Beeps is like, now the show is closing, and all of a sudden, yeah. But no, we're closing this show out. We don't have anything big right now. I don't think there's gonna be anything else. Everybody get some sleep. I'm gonna try to get some. Let's thank you all for your. Let's nobody try to panic. I think, like I've said a dozen times, these are procedures, and we're following the procedures not because everyone's going to die, but because this is what we do to keep as many people as safe as possible. She does that horror zombie face really good. This is what it takes to keep people as safe as possible for as many of them.
And I'm spending the evening watching American Hustle because my boyfriend's never seen it. I'm super excited. So.
Oh God! All right. Well,
we're gonna watch Amy Adams be a stripper. Yay!
I'm gonna be I got kids, no school for Massachusetts. It's 3 weeks now, so
3 weeks. Okay.
Yeah, 3 weeks. Wife's out of work for at least 2, so we're just gonna sort of stay here, play Baldur's Gate, and maybe Mass Effect. Try to avoid the X-rated cutscenes in Mass Effect, because 9 and 11. Try to be a good parent when I'm doing first-person shooters with my kids. I'm just saying. All right, all.
Yeah, my parents are. My mom works with the elderly as a caretaker, and my dad works in a hospital. So both of them, I think, are still going to be working. But
were you able to get a hold of them? I know you had a hard time getting a hold of your dad.
Yeah, I was able to get a hold of them, and my sister. She's in New York, and they're here in Texas with me. So, but I decided not to go see them because it's just one less person that might put them at risk because they are on the older side. So I'm not worried, but I'm concerned for them. So.
All right. Well, thank you all for and we will see you tomorrow 9 p.m. and we'll do it all again. Hopefully, there's not going to be too much to cover, but thank you all, and look forward to seeing you then.